I'm Mary McGowan, CEO of Women Heart, the National Coalition for Women with Heart Disease. We are excited to have the opportunity to discuss recommendations from the first National Policy and Science Summit on women's cardiovascular health. We will begin today, as we always do, by leading with our strengths, our dedicated and amazing women heart champions.
I have had heart disease all my life, but in 2006, I became a Women Heart Champion. I've seen firsthand how important it is to take care of my health and my heart, and I recognize the benefit of the education and support that have been provided by Women Heart. But there are questions that can't be answered and problems that can't be fixed yet due to the lack of specific information regarding sex differences in women. We need policies that can be implemented nationwide to make a difference for all women living with heart disease.
This is about women living with heart disease, but to make change, we're going to have to engage everyone. Government and society are critical to help us as we move forward. And Women Heart has been in the center of this in convening the group. We need to invest in the research that will most impact women with heart disease. And that means smart people helping us decide which research should be invested in, and then making sure that women are included in it. We need to create policies that will support the health of women and access.
Scientists can all agree that to advance the medical evidence base for women living with heart disease, it is imperative that women participate in heart disease clinical trials. Women Heart held 2 in-person focus group discussions with women living with heart disease. Participants in both the Caucasian and African American focus groups cited many barriers to clinical trial participation. Yes, a financial incentive, when that is available, does get women's attention, but that's just where the decision-making begins. Although participants in both the Caucasian and African American focus groups expressed deep-rooted fears about participating in clinical trials, both were very open to surveys, interviews, and discussions, and even blood draws.
We have worked on the Bipartisan Heart for Women Act to raise awareness and improve treatments. And we are continuing to work to ensure that once women are enrolled, that sex differences in treatment outcomes are not only measured, but reported upon, so the public becomes aware, so that professionals become aware as well. This work is far from over. As the summit has highlighted, we have much more work to do to improve clinical research processes, to increase the participation of women in all drug and device trials, enhance cardiovascular disease prevention, screening, and care, and promote appropriate use of cardiac rehabilitation services. We'll only be successful, as you know, when we work together.
As a member of Congress, I'm proud to say that I brought all that history with me and said we have to make a difference. And there's many ways that we can, but one I want to share with you is that I co-sponsored HR 3355. And this would allow our physician assistants, our nurse practitioners, and clinical nurse specialists to supervise the rehabilitation programs under Medicare on a day-to-day basis, providing access care for cardiac patients. This country needs healthy, alert, involved, passionate women. So you can count on me, and I'm counting on you to take care of yourselves, and we take care of everyone else, and we change this world one voice at a time. This message of our heart that we all only have one, that we must invest and take care of it, and so that we can continue in the next generation of being amazing in this country, because women stood up and made sure that the hearts of other women were beating strong. God bless you. Thank you.
If we demand today with a renewed sense of urgency that women receive sex-specific prevention, early and accurate diagnosis and treatment, women will live longer, heart-healthier lives. So let's make that commitment together today. Thank you.